Hello friends, I am Dr. Prashant Panchlothia. In Vet for Your Pet series, today we will talk about hypothyroidism. It is also commonly called goiter. Now, after these many videos for YouTube, I would like to make it clear to you that in these 10-15 minutes videos, the purpose is not to make you veterinary doctors, and nobody can do so. I also don't intend to make you a doctor, but just to make you aware of particular disease, particular condition, and also how to go about it, how to read the symptoms, how to decide that you have to go to the veterinarian now, and small hints and tips by which you can save your pet from some big ongoing disease. Now, coming back to hypothyroidism, first of all, let me make it clear that thyroid is a gland which secretes certain type of hormones. Now, these hormones are responsible for growth, cell repair, and metabolism. You know, when the child is young, at that time growth is important, but even after growth, after a complete attainment of the body, we require a lot of cell repair, a little of cell growth as well, and in day-to-day life, we require metabolism. Now, there are two types of conditions. One is hypothyroidism. Now, this hypothyroidism is only common. Hyperthyroidism takes place particularly due to the medication which is given and some other factors which you don't concern with, which you don't have to go into details for. But what you are concerned with is that when some type of medication is going on at that time due to overuse of medication inadvertently, then the symptoms of hyperthyroidism may develop, which you have to be careful about. Now, in case of hypothyroidism, or commonly known as goiter, there is lack of T4, that is the thyroid hormone. What happens? The basic symptoms are lethargy, intolerance to exercise, weight gain, excessive weight gain. In spite of the same appetite, you don't feed more and still it keeps gaining weight, becomes obese. Then there is mental dullness also in case of hypothyroidism. Apart from that, intolerance to cold. AC भी नहीं पसंद आएगा. They will not like to be in AC or other cool atmosphere. Increased hair shedding. Now, hair shedding is a normal routine part of the body of a dog. It happens sometimes once or sometimes twice a year. But in case of hypothyroidism, you will find that the shedding of hair is excessive and thickening of the skin, particularly around the face. But how can you find out? These symptoms, they can be studied properly by a vet. Now, what you have to observe? The same symptoms I will discuss another way so that you can understand what's going on. So, early warning signs, first of all and most important, is anxiety. Second is tiredness. They become tired very soon. Third is sometimes very loud breathing can be seen or heard. It can be associated with seizures. So these seizures may not be the routine seizures, but if you find that these symptoms correlate with each other, then you can go to the vet and he'll find out, and he will also give some sort of tests, which may be blood test or urine test as well. Then there is excessively high heart rate. Now, high heart rate is something which you cannot generally decipher easily. You cannot find out that this is increased heart rate or this is normal heart rate. But if you observe very carefully every time, then you will be able to make out that now whatever the heart rate is there is comparatively excessive. Apart from that, there is a shaking of body. Now this may be barely noticeable, but sometimes somebody may report to you, your son or maybe neighbor or your father or somebody or yourself, that there is a typical shaking of the body and intolerance to cold again. So that may be an important sign to make out that there is something amiss, something different. Lack of concentration and restlessness. The child, the pet, he will become too restless, will not be able to concentrate on one thing, and he will keep unnecessarily moving about or changing his concentration. Most important is marked hair loss, particularly on the trunk region. The face and chin, etc. may be having normal traces, but on the trunk you will find that the hair loss is very apparent. There might be patches or there might be big areas of hair loss. Most importantly, rat tail, that is to say the tail will lose the hair in such a manner that it becomes something like rat tail. Go to a vet immediately. Take care. Generally, it happens between the age of 4 to 10 years of a dog. Besides, toy breeds or small breeds are rarely affected. Not that they are not affected at all, but they are rarely affected, and the mid-size breeds as well as the large breeds are generally affected more. This is an observation, not a rule. Apart from that, we find that sometimes certain type of medications inadvertently given may cause hypothyroidism. So it's better not to take any medication by your own self. You should not be just asking people for some medication and start giving them. No. In case of steroids, it should be given only by a registered veterinarian, or it should be in proper guidance of a veterinarian, because a veterinarian knows how to give the steroids in which case and how much dosage and when to stop it and how to stop it. Something like the tapering dose, that is reducing to such an extent that slowly it gets reduced and then you stop it. So never ever give medication of higher proportions to your dog without consulting a vet, and a registered vet at that, not some layman. Sometimes anti-seizure medicines or many other medicines, it may result into hypothyroidism. Same way, the way it happens in humans, same way it may happen in dogs. Now there is something which nobody can take care of, which are autoimmune diseases. Sometimes there are autoimmune diseases, and because of the good strength of the body, the disease does not show its symptoms, but inwardly it may affect certain organs of the body, which includes thyroid. So hypothyroidism may be manifest due to some autoimmune diseases. Okay, now consider that we have at hand something like this, and before you go to the vet, you always feel, what can you do to help your pet, to help your darling? So to start with, It has been observed that vitamin D supplementation helps to overcome hypothyroidism. Happy? But not calcium, only D supplement, vitamin D supplement. Apart from that, vitamin C is also helpful. So, lime water or vitamin C chewable tablets, if your pet accepts that. Apart from that, there are some medicines strictly to be given under the supervision of a veterinary doctor and after taking the reports, blood, urine, blood report in particular. For hypothyroidism, some type of medicines can be given, which may be once in a day or twice in a day, depending upon the gravity of the disease or situation and age of the pet, as well as how much it has been given earlier. So, after starting, you have to keep your pet in surveillance. You have to keep consulting the vet every 15 days to 1 month time, depending upon how much time the vet has told you to bring back for consultation and for other type of tests, etc. Then the dose will be properly calculated and given. There are medicines, there is treatment, you can take care of hypothyroidism. Some people think that hypothyroidism doesn't get treated. No, it's wrong. It's a myth. Treatment is there, proper care is there. Yes, care is for long time. You have to take care for a long time, and once the medication starts, the hair loss, etc., is the last thing to regain. That is to say, it may take few weeks to few months for the normal hair growth, but the situation comes under control comparatively quicker or easily. Apart from that, people ask, what should we give for food and what should not be given in food or in other forms? So, let's come to food. Eggs, meat, fish are good. But what about the people who want to keep their pets on only veggies, vegetarian diet? In case of vegetarian diet, probiotics which are available in the market are good. Apart from that, seeds which can be normally had by any canine are good. So, edible seeds and dairy products in particular. Yogurt is good, then paneer is nice, then other forms of dairy products which your dog is habituated to can be given to the pet. Apart from that, high protein diet, that you have to decide by yourself that what high protein diets you can give. As I said, vitamin C is good, so lemon water containing vitamin C. Along with that, there is one thing which I found in my research is turmeric. Turmeric is good in case of hypothyroidism. It is also good in case of sugar problems and other associated problems, diabetes. But in hypothyroidism, turmeric is really good for the body. Apart from that, a lot of walk, or if possible, run. Your pet should walk a lot and should run. Now, sometimes you may tell me, some people feel that the problem is because of his tiredness. Tiredness is one of the symptoms, and you say that walk or run. So, walk or run should be taken as a part of treatment, and you can start with small distances but keep increasing the distance regularly. that will bring about a difference. In research, I also found that intermittent fasting, the way it is helpful in human beings, same way it is helpful even in canines. So you can try that in your own way, find out what is intermittent fasting and adjust the meal in such a manner that there is good amount of intermittent fasting for your pets. Now, I also told you that I will caution you what things not to be given in case you feel that there is thyroid, hypothyroidism. First thing is cabbage, cauliflower, spinach. They should not be given. Also millet. In Hindi it is jaw, bajra, juar or ragi. These millets in any form should not be given. Peanuts, peanut butter should not be given to the dog when he has hypothyroidism or goiter. Hot dogs, cakes and cookies are strictly forbidden in case of hypothyroidism in a dog. Now, sometimes after the treatment, if you don't go for a regular checkup, if you don't get the dose adjusted, there is a small possibility of hyperthyroidism. In case of hyperthyroidism or thyrotoxicosis, we find that there is panting, increased panting, nervousness, hyperactivity. The dog may start running from one to another place and will not be allowing even the veterinarian to touch him, or even the people within the house will not be able to approach. There is rapid pulse, there is increased drinking and increased urination. Along with that, there might be a little of vomiting, diarrhea, and very much of weight loss. If you find that your thyroid problem dog is suddenly started losing weight, then come on, take him to the vet and get the parameters checked again. There might be a little overdose. So, need not fear from hypothyroidism, but be careful. Any questions you can ask me. My number I'll repeat twice: 799-077-4805. 799-077-4805 is the number. You can call me anytime for any consultation. Thank you. Bye.